Recording. Okay, so thank you all for attending the Carroll County Chamber's Lunch and Learn today, where we're talking about mental health and awareness and some self-care and some things you can do to kind of take care of yourself during all of this and for the future. And I'm really excited that we have a big crowd today, and we have two great resources, and some of their folks are on the line. So we have Valley Oaks Health, and we also have the Family Health Clinic. So right now, most everybody is muted. So the chat function's open. If you have a question, please go ahead and type it in there. And hopefully we'll have a little time here at the end to be able to unmute everyone and maybe take some questions. So I'm just going to turn it over to Zoe. Zoe Franz is the Chief Strategy Officer and Director of Business Development at Valley Oaks. So Zoe, I'm going to turn it over to you if you want to go ahead and start. I'm going to stop sharing my screen and give you the control.
Wonderful. And I'm going to pull up my screen here. Can everyone see that okay? Okay, wonderful. And more people are coming in, Julia, so
Yeah,
that's great to see.
Perfect.
So just a little bit about me as far as being the presenter today. I have the honor of being the Chief Strategy Officer at Valley Oaks Health, so supporting all of our office locations. We actually have some of our wonderful staff in our Delphi branch. Our wonderful director, Deep, is on. And I'm going to have her in a little bit introduce herself and share some of the services. And then our wonderful team leader, Lauren, is on as well. She is going to stay muted though, because she is practicing work life with having kiddos and lunch break. And then Jade, who is in charge of our job placements and helping people find work through Valley Oaks and all of our locations. She's primarily based out of Tippecanoe County, but does some work in Carroll County. So I'm so glad she was able to join as well. So a little bit about me. I've done behavioral health my whole life. That's what I kind of tease in a variety of different roles. And also I'm a proud board member of Mental Health America, Wabash Valley region. That reaches to Carroll County. So I'll be sharing some of those resources. But more importantly, who is Valley Oaks? We are the Community Mental Health Center, not only in Carroll County, but also 9 others. And we started services, believe it or not, back in 1938. And those services provided are listed there on the screen to over 8,000 individuals of all ages. And we work towards recovery from mental health or the disease of addiction. We are Joint Commission accredited, and we have had the seal of approval for the past 25 years. Some of the services that we offer, this is agency-wide, is we have children and adolescent services. As you may or may not know, Carroll County, we provide school-based services. And of course, that's been a little bit of a transition for us with schools not being in session, but we've been providing those services via tele, and I'm going to have Deep hit on some of that in just a few. But these are all of our child and adolescent services. Our adult services are listed here, as well as mental health. We also do addiction, and I'm really proud to say that Deep has done an amazing job with getting some of those services up and going directly in Carroll County. Before I highlight our other locations, you want to just give an overview of who you are and the services offered at that location?
Sure. I'm Dr. Deepa too. A lot of people on this call already know me because I work with you guys directly or consult or come to board meetings and meetings in Carroll County. But I am the director at the Delphi branch specifically, and pretty much all of our services have converted over to telehealth right now. We are doing Zoom, we are doing texting, we are doing phone calls. We are even trying to use it, I think it's called Google Duo or Doc. I'm sorry, I always say it wrong. But any avenue to be creative in order to continue services with our client during the pandemic. We just started IOP through tele, and we're trying to expand that and grow it because we know that even though there's this pandemic, addiction is still up and running and people are still struggling with it. So we're still continuing to provide individual counseling. We're still doing intake assessments, substance use assessments. We're trying to do that group. We're still touching base with all the schools and providers. Case managers are doing a great job in being creative, and the people that are at higher risk, they're practicing the safe practices and social distancing, but the ones with the most higher needs are still getting services that they need. Even our prescribers are tele right now. We have a skeleton crew for the most part right now because of the pandemic, and so there's probably maybe up to 3-4 people in the building every single day, but everybody else is tele. So yeah, it's been really interesting. And here at Delphi, at least I know that we emphasize a lot of self-care and a lot of memes and sending emails and texts to each other. And we still do clinical staffing every other week. And Lauren Schneider is, if you guys don't know, but is one of the newer clinical team leaders in the area, and she's done a wonderful job with finding creative solutions for the case managers to do their services, especially with the children and adolescents. We are probably going to start doing groups with the children and adolescents, especially now that school has, I think school is going to be done in like a week and a half, I believe, with e-learning. So then, what do you do with the children? So we're trying to come up with some creative group solutions, and then if we can later on in the summer, if we transition back maybe around July, we might hold Camp Glow, where we teach social skills training and have activities and all that kind of stuff. So for right now, the next 3 weeks we're monitoring. We're still probably like in June we'll reevaluate, but for right now everything's tele, but we're still up and running. We're here. So if you guys need services or need to refer anybody, yeah.
Awesome. Lauren, was there anything else you wanted to add?
I just want to add that Brittany Spraker and I met yesterday, and we've discussed starting a parenting group. So we'll have more information to come on that soon.
Awesome. Jade, anything you want to share as far as anything you're doing specifically Carroll County or Tippecanoe that people from Carroll County are benefiting from? No? Okay. So here are all of our locations. Whenever I share this slide, people often have a wow moment because we do have such a reach. We have close to 500 employees, and these are all the locations that these employees are based out of. For right now, like Deep said, a lot of that is being done virtually, and we were able to get that up and going really within the first week that we were seeing shelter in place. I'm really proud of Deep and Lauren and Jade and the people on the front lines that were able to adapt so quickly. This is our strategic plan, and it's something I'd like to share because I do think it's important to stay strategic amidst a crisis. As much as it's hard to plan, there's still a direction and there's still a vision to be had, and I think that's something I hold on to through all of this. And so this is our strategic plan, is to be an employer of choice, to build brand identity, have community ownership, such as doing these calls, and delivering quality services, such as what's done in our Delphi branch. And I also like to share this because that's what my role is making sure that these pillars are being done and that we're following through on those and making sure that we're creating those connections in each of our communities. So we did change our name a while back. So I like to say it's a new name, same mission. And one of the things that I really wanted to highlight on this call, if you don't know, May is Mental Health Month. And the reason why I love this month is because I am a strong advocate that I want mental illness to be talked about at the dinner table, just like diabetes is, just like cancer is. And I would like people, our heart disease, and I would like people to be able to have those same conversations, to be able to get help and treatment, because I'm a strong believer that treatment works and that it saves lives every single day. And so Mental Health Month is a wonderful month to bring awareness to that. and bring awareness that 1 in 4 of us suffer from mental illness. And so we are doing quite a few community things. These webinars are highlighted here. We had one yesterday on self-care. 2 of our wonderful clinicians provided that. And then next week it will be focused on children and adolescents, how to talk with them through their anxiety through COVID-19. And then the week after, actually my 10-year-old, soon to be 11-year-old's birthday, will be on adults and how we can talk with adults regarding anxiety through the COVID-19. So please join us. These are free. You can access them on our Facebook Health Hub page. And then the other thing, just to make a note, because I love to see it, is Thursday, May 28th. We are doing a Green in the Valley Day, and that is everyone wearing green in the communities that we serve to bring awareness to mental health. If you have a building you can light green, whatever that might be, May 28th is that day. And then lastly, and we'll share this resource out, we've developed a robust resource called the Valley Health Hub. And that Health Hub, it has a number of resources on it, from mental illness to substance use for children, for adults. It has videos, it has resources for employers, whatever that might be. This Health Hub is available to anyone for free to help in giving people the resources that they need if they're struggling. So I wanted to transition a little bit into taking care of yourself and your staff during COVID-19. And I'm going to let Allison really highlight on the taking care of yourself, since she's the clinician as part of this panel. And I'm going to focus how to take care of your staff, since a number of us are in business, whether you're a small business or a large agency. I think it's really important during this time to practice compassionate accountability. You know, we moved to virtual. And so, you know, we don't really have that same level of accountability as we do as leaders when we have staff that are virtual. And so making sure that you do regular check-ins, that you increase your frequency of communication, that's important not only to our clients, but also our staff. Some of the ways we've done that at Valley Oaks is we've had our CEO is sending out weekly emails. I myself started a Cup of Joe with Zoe series where staff get on the line and have discussion around any sort of topic. And it's a connection of staff being able just to feel connected to others. We also did a special edition newsletter, as well as some focus groups. We have a couple of our case managers who are meeting at a park and socially distancing, where they're able to provide support to one another, because for us, it's taking care of the caregiver. So while our staff is experiencing COVID-19, they're also experiencing it from all of their clients. So we've been trying to be very intentful and diligent at making sure that we're caring for our staff. Making sure that we recognize that this is traumatic for everyone and not to put the blame on anybody for our staff. Some other tips is approaching others with compassion and empathy and extending care without judgment. So fear is a condition, not a weakness, and respectfully sharing relevant facts. That's one thing we've been really honed in on here at Valley. There's so much out there. And so if you start going to all these, that is just so overwhelming for staff. So we've really used 2 main resources, and that's the CDC and the WHO, to the World Health Organization, to really help in guiding us with what our phase-in plan is going to be and how we're going to provide services. So making sure that we share those relevant facts and then address unwarranted concerns. Oh, and that list is plentiful, isn't it? The unwarranted concerns that might not be fact-based, but you have to have empathy while you're addressing those. Making sure that you are connecting, whether it be morning huddles, team huddles, holding on to some sort of structure and supervision in your day is really important for your staff. Making sure that you do connections, whether it be fun things. I think you guys shared about doing memes or sharing, you know, having a coffee break. One of the calls I was on this morning, that business owner does a Thirsty Thursday, where they get together and talk and connect with staff, or a Wacky Wednesday. We're doing a theme week this coming week at Valley, and even though staff are at home, we're encouraging them to all participate. Sending encouragement to each other. I've been blown away by the level of encouragement that staff have sent to each other, and just sharing that and being a support to one another. So every day, just kind of asking yourself, what is your strategy for being at home and connecting with others that you work with? I think it's so important to be very intentful and strategic in what you are going to do for that during the day. And then the other thing that I wanted to share is just some other resources that are not tied to either clinic, but the Mental Health Navigator program. That number is there, and the Navigator does service Carroll County. And so if you have employees who are struggling with getting connected to services, please have them reach out to that number. And then the last plug I wanted to say is the Quick Response Team. While they do not provide direct services in Carroll County, we're starting to do a little bit more of that. And that is a peer-based program where a peer who has walked the life of recovery with substance use gets connected to someone who is needing services, and they help in navigating. And that's probably a whole nother webinar on the power of a peer. I can't sing its praises enough of what it's done in Tippecanoe County. It's decreased our overdoses significantly, and also our jail recidivism. It's been very powerful. So that's a number to keep in mind. And then I'm going to turn it over to Allison so she can share about the clinic and then also some self-care tips. I'm going to stop sharing my screen so you can. Got it? You're muted.
I knew I was going to do that. Welcome to the world of Zoom, everybody.
Yes.
I'm Allison Dowdy. I'm a licensed clinical social worker. I'm one of the behavioral health consultants at the Family Health Clinic. And I'm very thankful to have this opportunity to present to all of you and share information. I think this is sort of the moment that in the mental health field we've prepared for our whole lives, but dreaded the possibility that it could ever happen, that we are having very open dialogues about the importance of mental health, and people are sharing more information about their mental health. And like I said, it's worst case scenario. This is not anything that any of us would have predicted, but hopefully by having these types of conversations, we can help decrease the stigma around mental health. I love that Zoe kind of talked about it in the context of it should be a dinner table conversation. It should be something that we share. 1 in 4 people does have a mental health condition. And by not discussing it actively and vocally, we're doing a huge disservice to each other. So I've always been really passionate about self-care. So let me get my screen share going here, and I will share my PowerPoint presentation. A little bit about myself. I'm working at the Family Health Clinic now. I received my bachelor's and my master's degree from IU, Bloomington in the case of my bachelor's, and IUPUI's campus in the case of my master's of social work. But I kind of took a pause in between there and was working at a facility that was a group home for kids on probation, and then kind of graduated from that program to a day reporting program, still working with kids on probation, and just got really frustrated with the sort of mechanisms and systems failures that kids were being sent to prison, basically the Department of Corrections. And from my standpoint, I hated that, and I just wanted to make sure that I was trying to do something to prevent that from happening more. So while I was still working full-time, I went to graduate school to get my master's degree in social work part-time. And sitting in lectures, they started talking about the importance of self-care to prevent burnout. And I was like, I'm already burned out. I don't understand like why we didn't have this conversation. I feel like people should have been saying these words burnout and compassion fatigue to me years ago. And so I, through this process, kind of became a champion of taking care of yourself first. But that's a little bit about my background and kind of why stress management and self-care is so important to me. But about the family health clinic, we do have 4 locations. Delphi is kind of our main one that I would say most people are most familiar with, especially the group that we're speaking with today. But we are an FQHC, or federally qualified health clinic. Primarily, we function as a primary care medical clinic, but we have women's services, there's pharmacy. Barb, who's part of our insurance navigation team, and then behavioral health, and Deep kind of wears 2 hats in this county, that she works with us one day a week. We're very fortunate to have her work with some of our patients who have substance abuse issues. And this year is a big milestone for us, that we are celebrating 25 years in 2020. And we're hoping, when social distancing kind of becomes a thing more of the past, to be able to have a big community celebration and really acknowledge that it's a big event for us and for the community as a whole, because I think we are a big integral part of this community, and a lot of Delphi and Carroll County residents do come to our facility for their health care and behavioral health care. So I keep using this term, what is self-care? And I know for a lot of people, they haven't heard this term before. Luckily, I see a lot of mental health people on the call, so I know they have, and a lot of my coworkers, we've been using this phrase a lot. But the basic notion of self-care is the practice of taking action to preserve or improve one's own health, and the practice of taking an active role in protecting one's own well-being and happiness, in particular during periods of stress. So I think the key piece of this, even though self-care itself is a noun, it's really a verb. It's about doing and being very active in it. And that last part of that second definition there, during periods of stress, I don't know about anybody else, but I don't know that I felt this stress since I was doing that full-time job and part-time grad school. On top of it, just every aspect of my life has changed a little bit, and I've been very fortunate that I've not been directly impacted, but there's still been lots of stress and change for me, and so it's kind of thrown me for a loop. And so I'm so thankful that I learned about self-care all those years ago. But there is a notion, and I hear it a lot, that I keep telling people, even, you know, like, we are all in this together, but that doesn't mean that we're having the same experience. So the sentiment is helpful and true, but it's not always accurate. So what I've kind of been saying to my clients is, I've been preparing them, like when I first talked with them about COVID and what's going on, I say that we are all in crisis, whether we know it or not, but how directly that crisis is impacting us and how well we're coping with that crisis, that's an individual experience. For some people, these small disruptions in their life have completely knocked them off kilter. Some people have had big changes in their life experience, but they're actually coping with them pretty well. And so really, it's an individual experience that we are all collectively having at the same time, is the way that I kind of view it. And I try to normalize with all of my clients that even if it's a minor change that you're having a hard time adjusting to, that's okay. So some of the trends that I'm seeing that are maybe some possible indicators that we as a human race collectively are not coping very well. There's lots more complaints of sleep difficulty. I'm seeing lots of different articles online. My clients are reporting this. I personally am experiencing this as well, that I'm working really hard to try to get back to my normal sleep routine, but it's not working well for me right now. We're seeing lots of reports of vivid dreams with the increase in stress. So people possibly are not getting into as deep in their sleep cycles because they're remembering their dreams more, and decrease in physical activity overall based on activity tracking devices. People aren't as physically active. For me, I know I'm sitting in my Zoom conferences all day instead of being up walking around the clinic, but in general across the board, we are seeing lots of decrease in physical activity. Alcohol sales are up. A lot of people are drinking more. To me, that's a sign that we're probably not coping well. My hope is that people are just having Zoom cocktail hours and drinking responsibly and staying connected with their friends in that way. But my mental health worker inside tells me no, it's probably because we're trying to avoid coping with the stress. Police agencies across the United States are reporting lots of increase in domestic violence calls and calls that they're responding to that are related to kind of domestic disturbances more over the past few weeks, and an increased call volume to suicide prevention hotlines. So all of these to me are basically screaming that we need more self-care, we need more mental health awareness and intervention. And so if we kind of revisit the topic of self-care, there's no real like universal, like these are the only types of self-care. There's lots of different representations of it. The ways that people sort of talk about it and discuss it and categorize it are all different. I really like this one because I feel like it's pretty well rounded. Literally, it's a wheel, but there's different categories here that if you're only focusing in one area of self-care, then you're probably not living a totally balanced life. And so this is from Olga Phoenix, and I've included this as a handout that I believe Julia has your contact information that she can share some of these resources with you. But the way that I approach self-care conversations with my clients pretty universally is I try to get them to focus on sleep. Primarily, I tell them if you're not sleeping well, you're not doing anything well. Physical activity. I could bore them with the research all day long, but I usually tell them if you're more physically active, it burns off the stress chemicals, it reduces the anxiety and the physical symptoms of depression in your body, and it gives you a mood boost. That usually is better than me talking about all the cognitive and physiological changes that exercise is going to introduce for them. I talk to them about nutrition. I tell them that all those years of doctors nagging them, they were right. Like the better we eat, the better we feel. And then the fourth area of self-care that I try to get my clients to focus on is leisure and recreation, finding hobbies, doing activities, making time to do things that you enjoy. So basically, I kind of treat this as a skeleton key. If they are doing a good job in these four areas, most of their other areas of life are going to naturally improve as we're kind of focusing on these aspects. So if we kind of think about how do we know we're experiencing high periods of stress, what do we look for? You might see some similarity between this and the previous slide, the areas that I focus with on my clients. We're usually going to see changes in sleep habits and patterns. We're going to see some changes in appetite, either just losing interest in eating or maybe eating more than you ever had. That's again a manifestation of my stress during this. I am snacking. I've kind of jokingly told my friends, I think my strategy is to either sleep or eat my way through the apocalypse, because like those have been the two areas that I find myself kind of gravitating towards. But changes in mood. Anybody feel like they're not handling their stress? Maybe they're a little bit more irritable with their coworkers, their spouse, their kids, like little objects around the house not working well. I the other day like threw my dog cushion because I was trying to like film something for like a pound class. I'm also a pound instructor, and my dog started doing inappropriate things with a cushion while I was trying to film a video to submit, and I just lost it and just like tossed the cushion, and I sent the blooper reel to my friends, and I was like, that's not me, that was just my stress in the moment. And so we have those moments of being human, and like our moods change when we're under high stress situations. Changes in activity. A lot of people don't do the things they normally do. I don't reach out to my friends. I, would go walk every day. I'm not doing that. So a lot of my clients and people in general just kind of report that when they're feeling really stressed, they just don't do the things that make them feel more like themselves. So, what can you do to manage your own stress better? To me, this is the most important thing. Whether you are an employee or an employer, you need to manage your own stress first. And so if we think about those four main areas of self-care, I always set goals with my clients related to those as well. Practice good sleep hygiene. I'm trying to get back to my consistent bedtime, wake up time. That helps me. Predictability and routine is nurturing and comforting and reduces a lot of stress and anxiety. Increasing physical activity. I work out a lot. That's an area that I do really well in my self-care. In addition to being a full-time therapist, I also teach part-time pound exercise classes, if anybody's familiar with those. So that for me has been a huge outlet. And so when I tell my clients this, I'm like, I was never an athlete. I'm not coordinated, but that sparked my soul. And I remember leaving a particularly stressful day at work and feeling like, whoa, I feel better. And so getting that physical outlet, I encourage my clients to find their own version of physical activity that helps them feel that, whether it be walking their dog, whether it be swimming if they have access to a pool. That's where most of my clients find starting. Is like, oh yeah, I like to swim, or I like to go for walks, or I like to ride my bike, are kind of the three most common. And I'm like, that's good. Let's try to do some more of that. Trying to eat healthier and eat mindfully. So the mindless snacking, I know, like I'm always in my pantry if I don't have something to do. So I've enforced a rule for myself to get myself a little bit back on track, that I have to eat like an orange or an apple or a piece of fruit or a vegetable before I go for my chocolate. So that way I'm at least getting some vitamins and minerals in there. But being aware of sort of what you're eating and why you're eating, and try to increase the fruits and vegetables while you're going through stressful periods of time. And you'll see me throughout kind of drinking my water. I always have my water bottle around. Like I can't stress enough the importance of drinking a lot of water as well. Engaging in hobbies regularly. This is an area when I talk to adults and we kind of do our needs assessment and we're talking about things, most of them I ask, what do you do for fun? And they laugh at me and they're like, I don't have time for fun. They don't have friendships a lot of times. They don't go and do things without like their kids being there with them. They don't read, they don't write, they don't listen to music regularly. They occasionally do some things. But finding hobbies and recreational activities really is an important aspect of our health that I think a lot of us don't spend enough time prioritizing to make sure that we are including that in sort of our daily routines. But as I put at the bottom, regardless of how life has changed for you, try to follow a daily routine or daily schedule and ensure you're allowing adequate amounts of time for self-care. You need more self-care time than you did even prior this pandemic starting, and most of us were already lacking in how much time we were devoting to our own kind of mental, physical, emotional well-being. But when you kind of schedule yourself that time, usually there's more accountability to yourself to actually stick with it and make sure that you do it. So as an employer, again, reviewing a little bit, the first thing I want you to do is take care of yourself. And then the second thing would be to focus on, it's saying my internet connection is unstable on my end. Can you guys still hear me okay?
Oh, no. Mm-hmm.
Okay. Can you hear me all right?
Mm-hmm.
Yes.
Okay.
Yes, I can hear you.
Sorry, it's still giving me the message, and occasionally like my internet goes out completely. But as an employer, like you can decrease the stigma and start a conversation. Let your staff members know it's okay. Let your staff members know it's okay to come to you to talk about it. You can post information around that there are resources available. You can increase breaks and decrease productivity standards, be flexible. I've been telling everybody with this to lower your standards and expectations. It's going to take you longer to do simple tasks just with the way that our brain responds to stress. And so thinking about that as an employer, a manager, a supervisor, deadlines might need to be extended a little bit. If it would normally take 2 days, maybe it's going to take 3 or 4 to be able to complete tasks, and recognizing that we're not under normal circumstances, so normal expectations may not be a fair assessment of what to expect from your employees and coworkers. Check in with employees, ask them if they're doing okay. You sleeping all right? Are you know, did you have lunch today? Did you take time to take a break? Making sure that they know that it's okay to do those things. Basic needs I put on here because when it first started, if you guys all remember, you know, the great toilet paper panic of 2020. And I told everybody, I made it clear that if I run out of toilet paper, I was going to put some money on a shelf, but I was stealing some from work. And so we kind of checked in like, if you're stressed, if you need groceries and don't have time to shop, let us all know, and we can provide for each other. If anybody runs out of diapers, toilet papers, those type of basic needs and essentials, let's all like be there for each other in that way if we need to. And you may know your employee's situation, but you may not know those significant others. Maybe they've been laid off. Maybe they are struggling to put food on the table and meet all of their basic needs. And so letting your employees know that you care about them, not just as an employee, but also as a human being, I think is a very important step to take during this time. Giving grace. I stole that phrase from another therapist that I've worked with, because to me, we are a lot of times just really focused on what's going on in the moment. And when we see somebody be irritable or frustrated, and it's just kind of like easy to write that off as like, that's just a character flaw, that's who they are. But we are all in the midst of a pandemic, and we've not been through one before, and we are not ourselves, and we are all doing the best that we can just to get through day to day. Some days we may be doing really well, some days we may be struggling. And so just give people the grace to recognize that they may be struggling with things that you don't even know, and treat it as that in that moment. They may not be acting as we want them to, but that doesn't mean that they're not who we've always known them to be. Setting the tone and leading by example. Take self-care time for yourself. Let people know. I kind of like have been sneaking out to sit on the gazebo at lunchtime to kind of like make it very visible. Hey guys, I'm doing self-care, without actually saying, you know, we should all be doing self-care. I do pound classes. Normally I kind of practice songs on my lunch break. I show people that I don't just talk about it, I am actually doing these activities. And so you as a manager can set the tone. If you are taking a lunch break, that signals to your coworkers that you can do that. And some things that we're doing at the clinic, I think very similar to what Valley Oaks has been doing, is a lot of boosting staff morale and trying to decrease the stress, because work environments can be stressful normally, and under these circumstances, even more so. And so we started that dialogue. We give frequent reminders of self-care. We've started doing daily staff call-ins in the morning, and we all talk, and you know, every few days I'll shout out, make sure you're doing your self-care in the background, or give some kind of a reminder. We've done some themed dress days as well, you know, choose a color. Like we've relaxed our dress code. It seems like it's really just a trivial thing, but when you spend less time having to figure out what you're wearing in the morning, that's one less stressful thing you have to deal with. You're feeling comfortable in your clothes, then you don't have that irritation of trying to fix your clothing all day. And it's just one more thing to kind of reduce the stress a little bit. And anything you can do to kind of introduce some excitement to people, that it's kind of something that's not the normal, like it does help to reduce stress and boost morale. We've also been ordering lunch from local businesses more frequently. Our social work team will kind of put together, hey, you guys want to order from this local place? Because then it's supporting the community. We feel empowered. It helps people to kind of feel like they're not powerless. They're able to help other people in the midst of all of this. Again, a silly thing, but ordering lunch really helps. And then you're also bonding with your coworkers, talking about, you know, what are you going to get in that time? We've done a COVID bingo, just things around the clinic you might see that, you know, I just made a quick like Google like bingo board, and you can put your own ideas in there and tailor it to your own workplace. Weekly check-ins with staff. I have to give a shout out to Barb Hickner, who is one of our insurance navigators. She early on was kind of like, we're not as connected as we normally are. And so she has kind of put everybody's physically, is it a jar I think she's using, but she has the names of all the clinic employees. And there's a team of us who have volunteered to say like, yeah, I'd like to help check in and see how everybody's doing. And so each week she'll pull from the name and sends out the email of like, this is your person. And then we send a quick email, you know, checking in like, hey, how are you doing? How are things in this department? Hope you're doing okay. And we stay connected in that way. She also has asked us to send in pictures of us like working from home, our home office. So we've got, you know, lots of pictures of people with their kids and their pets, and just kind of, you're not in the office, but you're still an important part of this team. So that's helped to build us our connections and keep those connections going as well. An important thing that we were able to do early on is partner with Purdue University and their counseling and psychological services program. We knew this was going to be a very stressful event for our staff because we are primarily a medical clinic. And this is a medical phenomenon going on. And we knew like our patients and our staff would be impacted, that things were going to be really stressful. And so there were some Purdue employees that aren't working as much because campus is closed to students. And so Purdue did this talent share of, these are some people that might be available. Is there things you need, so that they could match people who aren't working in their normal capacity with people who might have a need that could, you know, reach out to those employees. And so the CAPS program at Purdue has partnered with us to provide counseling services for our staff if needed. And if you are a larger employee, if you have employee assistance programs, that would be great, just to continually remind your staff that those are available. But this is a bigger piece of an ongoing office culture initiative. We're not just trying to respond during stressful times. We're trying to make our workplace enjoyable all the time on a daily basis. And a lot of these things, we've done the bingo things before, we've done dress up days, we've done casual days before. And so if it's not something that you have done before, I would highly encourage you just to take some time to try to implement some of these things to make work more fun, make people enjoy being there with each other. Because in a lot of ways, I mean, we're the family health clinic, but I do think of our coworkers as like a larger extended family. And so we can be there to support each other in lots of big and small ways. So I'm always someone who wants a takeaway from a presentation, because I feel like I get lots of information and I'm like, oh, that's a good idea. That's a good idea. And then it's like, I never do anything with it. And so I like handouts. So I have provided Julia with copies of these, but some 50 ways to take a break is a good, just visual, quick little pictures of ways that you can practice some quick self-care. You can hang this in your office. You can keep it for yourself. You can share it with your employees. There's also a self-care assessment that I like it. There's lots of different areas of self-care. It was kind of geared more towards like mental health professionals. So you'll see a couple questions in there that'll kind of like says like have your own mental health therapy or things like that. But for the most part, I do this with my clients a lot. It's just lots of areas, and I kind of challenge them on areas that they're a little bit lower, that if they're feeling like they're kind of burned out in life, that might be because they're not doing enough self-care in this area. And you can also identify your strengths of these are what you're really doing well. And that's probably what's helping you cope in these situations. There's a National Sleep Foundation sleep diary. And so there's lots of little hidden sleep cues in there. Like it asks about caffeine, alcohol consumption, like what time you went to bed, how many times you might have woken up throughout the night. There's just lots of areas of sleep. And then if you kind of recognize like, hey, I can look for patterns. Maybe I didn't do this as well, or days that I'm eating a lot of food before I go to sleep, I'm not sleeping as well. And so I've included that as well. The blank self-care wheel here is so that you can try to identify your own self-care activities that maybe you might want to do or are already doing in all of these different areas of self-care. And then the last one is just a 30-day self-care challenge to give you some ideas of starting to set goals, doing different activities, and then seeing how that can kind of benefit you. So the big important takeaway that I want to leave everybody with is the put your own oxygen mask on first. So anytime we all sit on an airplane and they go through this, they always say it. And I always ask my clients why. And they're like, I don't know. And I'm like, because you're no good to anybody else. If you put that oxygen mask on the child is more likely to survive that situation, but the child can't pull other people out of the plane. The child can't, and it kind of walk them through that scenario. So a lot of times I think people feel selfish if they are putting their own needs first, but it's really because that's what we need to do. We can take care of others better if we're taking good care of ourselves. All right, so I think at this point we were planning to open it up to any questions that people might have.
Right. Wow, this is fantastic. Boy, thank you both for lots of great resources. Yeah, any questions, please, I'll give everybody the opportunity to unmute yourself. And for some reason, let's see, unmute all, do that. So does anybody have any questions? You should have the opportunity to ask one. I know one that I've thought about is with employers, especially, and the challenges that they're going to have, cutting down on the, like the break rooms and having so many people in the break room at one time. So thinking about staggering things like that, and for self-care, how do either of you guys have any, I think, tips for an employer on maybe what their break room should look like, or what can they do to have activities that might help cut down or help with the self-care?
Mm-hmm.
So I know with Valley Oaks that we have actually put into place for now, break room groups of any larger than 10. I know that it's moved to 25, but we're still staying pretty conservative with that we're not allowing that. But that's where we rolled out the Cup of Joe with Zoe and a couple of our other focus groups and the support group that meets outside. So just getting creative, because there are things that you can still do to feel connected. And I know there's, virtually, there's also some studies out there that people are getting kind of zoomed out. And I can go along with that for sure, but if there's a way to stay connected from afar, using that space. I know we've, put wipes and those sort of things in our break room so that people can sanitize as we do use them, since a lot of staff do bring their lunch or like to get takeout, but just being very aware of that and also keeping that safe and clean. Having those masks and having those supplies available for staff, I think would relieve some of that anxiety.
Okay.
And I think it's a challenge because every physical office location looks different, is different. We're a medical clinic. I've got like my N95 mask over here. So when we're together and in close proximity, we're supposed to be wearing our masks. So if you need that kind of like physical closeness, then there are still safe practices you can put in place. But I have been telling all of my clients, try to get outside every day. And so think about like utilizing outside spaces. Is there, like a little patio set that you could stick out there, a few chairs to encourage people to get outdoors when the weather cooperates with us, and think about that as an option to take a break too, to actually physically step outside and leave maybe the stressful work environment behind for a little bit. From most of the things I'm reading, we still want to follow like the social distancing guidelines. But outdoors, from again what I'm reading and what we know now, it appears that you're less likely to transmit or contract if you're in an outside, well-ventilated area. So that might be an option too, to encourage your coworkers and employees just to go outside and get some fresh air.
Yeah. Okay, and Jade had a good point too about how some employers are using their conference rooms now. So at least to kind of spread people out and have different spaces for them to go. So I think that's a good idea.
Absolutely.
Okay. Any other questions from anybody? Well, Jackie, how about you?
Julia, I did have a comment that I want to make for the staff at Valley Oaks. I have been getting emails from Zoe to join some webinars, and we had a Zoom conference last night with Holly and Nathan, and it was how to tend to your own self-isolation, and I got a lot out of them, but the questions that people asked were just, it's like, oh my gosh, I didn't think of that, or oh yeah, that would help me. So I encourage you girls from Valley Oaks to push that out more. I think more people will be receptive to the Zoom meetings, but it was very enlightening for me and other staff that I had in my office. So I encourage you to keep that up, because I'm going to send it forward from my group, because it was just very informational and very, I don't know how I want to say it, but to know that I wasn't the only one thinking that the stress that others have, it's sort of like, how you like misery loves company. I mean, it really helped out a lot.
Good. Thank you for sharing that, Jackie. We did those in place of our summit because obviously with not being able to have large groups, our summit, we were planning on about 300 people. And so we put the weekly webinars in place to still have some of that education, but most importantly, the connection.
Thank you.
Very good point. Very good point. Trying to manage my screens here. Okay. Yeah, so Zoe, let's see, you have another webinar coming up next week, correct?
Yes, and so those, that will be on the handout. That was one of the attachments. So that
Okay.
they are the next 2 Wednesdays at 4 o'clock, and you can register via our Health Hub Facebook page. And just one other
Okay.
final kind of plug regarding resources. Sometimes an employee doesn't feel comfortable reaching out to their employer to get help. And so putting these out in a place, whether it be on your internet, whether it be within like a common area that people walk by, just to have these resources just there, very similar to the domestic violence calls, cards that you see in the bathroom at times. Just a little something just to lay out, and they might grab it and attend and benefit like Jackie did and share and really be able to gain something from that. So I think just being that resource and having that available really the way to make the most impact with your staff.
Okay, perfect. Excellent. Yeah, so if you signed up for this luncheon today through our website, I should have your email. If you jumped on the call and you haven't done that, please add your email address to the chat box, and I will definitely send you everything that both of our speakers have shared today. It's been good, very good to hear, and I certainly hope that we all do a lot more self-care and be willing to share and talk about issues. So thank you, all of you, for being here today, and especially to our speakers. It's been wonderful. I appreciate you. So
Absolutely.
anyway, all right. Well, we've
Thank you for the
recorded this.
opportunity.
We'll upload this. So thank you all so much. I appreciate it, and have a wonderful afternoon.
Take care. Have a
Great.
great day.
Take care. Bye, everybody.
Thank you.